hormonal and metabolic disorder that is a leading cause of infertility in women recently had a name change. Polycystic Ovary Syndrome is now Polyendocrine Metabolic Ovarian Syndrome. Dr. Deborah Akina-Abel, or Dr. Debo, is a reproductive endocrinologist and infertility specialist at Aspire Fertility Austin. Thank you so much, Dr. Debo, for joining us again to talk about this.
Thank you for having me.
We always love when you're here. So why the name change?
Yeah, so polycystic ovary syndrome has long been known to be a misnomer, meaning that patients come in thinking that because they have this diagnosis, they have cysts on their ovaries, or because they have cysts on their ovaries, they have polycystic ovary syndrome. Well, in reality, you don't actually have cysts on your ovaries with polycystic ovary syndrome. It's more of a hormonal dysregulation that can also have effects on your metabolism, so an increased risk for diabetes and obesity and heart disease. And so there's been a big push to change the name, and recently the Endocrine Society sent out a worldwide survey.
And you were part of that.
And I was part of that to determine what do physicians who treat this condition believe will be a better name for the condition. And they landed on a name that reflects what the condition actually is. So polyendocrine, meaning multiple hormones, metabolic, reflecting the issues with diabetes, insulin resistance, ovarian, of course, the ovary syndrome.
It's longer, but it's more accurate.
Exactly. And they wanted to keep the acronym as similar as possible
Sure.
to aid the transition.
Sure. And so what are the symptoms?
Yeah, so it's important to note that the diagnostic criteria are still the same.
Okay.
To have PMOS, you need to have 2 of 3 symptoms. Number 1 is irregular periods, which is usually due to the hormonal dysregulation that occurs. Number 2 is having symptoms of high testosterone, or actually having high testosterone or other male hormone levels and blood work. So that includes increased facial hair, increased adult acne. It's important to note that this symptom of acne is not included when looking at adolescents with PMOS, because acne, as we know, is a very common feature in adolescents. And then the third is you need to have ovaries that have what we call now a PMOS morphology, meaning you have 20 or more follicles on one or both of your ovaries.
What about weight gain?
Weight gain is not part of the criteria, but it is a symptom of the disease.
Okay, because I heard.
Exactly. So women with PCOS are more likely to develop obesity, about 10 times more likely to have diabetes. And there's a chicken and egg relationship where PMOS increases your risk of these conditions, but then if you have PMOS and have diabetes or obesity, that also makes your symptoms from PMOS more severe. And so you really want to address, and this is part of the push, is to make sure that physicians are addressing this condition on a more holistic level versus only focusing on the ovarian and fertility-related risks from the disease.
Tell us how exactly it affects infertility.
Yeah, so the most important way that this condition affects fertility is through irregular ovulation, or what we call oligo-ovulation in the medical term, meaning that you're not releasing an egg every single month. Okay. In order to get pregnant, you need to release an egg, which can be fertilized to result in a pregnancy. But if you're not releasing an egg every month, then that makes it harder for you to conceive. And all the other factors all play a role in how frequently you're able to ovulate on a regular basis.
With a patient with this condition, at what point, if you're suffering with some of the symptoms, do you go seek a professional help?
I would say if your periods are coming more than 35 days apart, so if day 1 of one period to day 1 of the next is 35 or more days apart, that's definitely a reason to seek out a medical professional, because that is longer than is normal. Okay. If you find that you're having increased hair growth, called hirsutism, either like in the male pattern, so your chin, your neck, your back, lower abdomen, upper abdomen, those are reasons to get that evaluated. Now, with regards to if you have diabetes, obesity, I think that, as part of the workup, they could do an ultrasound to see if you have that PMOS morphology of your ovaries. But it's more important that if you're diagnosed with PMOS, that you are then screened for diabetes and heart disease, keeping in mind that as you get older, your risk of developing those additional metabolic syndromes is increased.
Okay, so what treatments are there out there?
So the first line for treatment of PMOS is lifestyle, which is why, again, including metabolic in part of the name is so important. So you want to focus on increased activity, focus on a diet that is a low glycemic index diet, meaning that you're eating foods that require more work to break down. So whole grains, fruits and vegetables. You want to avoid processed foods. I usually recommend that my patients speak with a dietitian or a nutritionist to really go over their nutrition and make sure that they're optimizing for their metabolic health. Next step, if those interventions are not helpful, are then seeing a reproductive endocrinologist if you're trying to conceive. to talk about options to help you ovulate in a more regular fashion.
All right, Dr. Debo, we appreciate your time. Anything else that people need to know about this condition?
I would say the most important thing is to make sure that if you're diagnosed with PMOS, one, it's very treatable for infertility, and two, to really think about a more holistic approach to the diagnosis versus just a medication one and done approach.
Good takeaway, Dr. Debo. Thank you so much.
Appreciate it.